We're back with Dr. Naomi Lane and Dr. Mikey Farmer answering all your oral health questions. All right, Dr. Farmer, let's kind of like put all these together. What's the best way to whiten your teeth? Are the teeth whitening kits sold on Amazon good? Is it safe to use those UV kits for teeth whitening?
So again, I would recommend asking your local dentist. There are some very safe and effective ways of whitening teeth. Whitening teeth has probably been one of the most researched topics in the last 20 years, and we've shown that you can actually whiten your teeth safely. It doesn't damage the enamel. But the important thing is to do it the correct way. So we don't want to be buying purple toothpaste off of TikTok or charcoal activated toothpastes that can be abrasive to our teeth and actually remove the enamel. There are safe methods, and ideally your dentist will make sure that you're getting the products that are approved and researched.
Okay. Dr. Lane, this person says, my granddaughter is 7 and her 2 teeth on the side are loose. One came out. Is this the age for them to be coming out?
It is. That's a great question. Typically around age 6 is the first time that children will start into that transition of getting their permanent teeth, but it's a wide range. It's somewhere between 6 and 8. Children will lose their 4 incisors on the bottom and their 4 incisors on the top, and simultaneously be getting in permanent molars in the back 4 corners of their teeth. So it's right at that age.
All right. What's the tooth fairy giving these days?
Oh, the prices have been steep these days. I've heard anywhere from, it used to be a quarter. I mean, it's up to $20 a tooth these days.
Whoa. Okay. All right, Dr. Farmer. This person's asking something about money. How much do implants for a molar cost?
Okay, yeah, that's a great question. And again, it depends on your insurance, if you have insurance, because each of those fees are negotiated with your provider. Typically, when people ask that question, I give a roundabout figure because it's going to be somewhere around $4,500 or something like that. But it's multi-stage. So the nice part about an implant is often we place the implant, which is a surgical procedure, and then we wait at least 3 months for that to heal. And then we do the part where we actually put the tooth in your mouth, the crown and the abutment is what it's called. And so you can actually break up, that helps to break up that cost over time and allows you to save some money to get the final part.
All right, Dr. Lane, this person's asking, what toothpaste do you recommend for young kids?
Well, again, similar to what we mentioned about the chewing gum, you want to make sure that you're looking for the American Dental Association seal of approval because they do rigorous testing for safety and efficacy. Children are recommended to start using a fluoride toothpaste as soon as that first tooth erupts. It's just in very small amounts. So obviously we know that children at a young age, there's a risk of them swallowing too much toothpaste, and we don't want to have too much fluoride. So regardless of the brand or the flavor, it's important to use a fluoride or a fluoridated toothpaste, but making sure that we're starting on it as a very small amount on those bristles, up to a pea-sized amount only for young children.
All right, we're coming up on about a minute. Dr. Farmer, this person says older people like to share peppermints. How bad are they for your teeth?
So they do contain sugar, so I would recommend getting the sugar-free kind. I know they have those available. Also, crunching down on them. If you're biting them, those I've seen too many times people come in with broken teeth and molars, and that really is a costly procedure to get that fixed. So if you could do the sugar-free and just keep it in there and don't bite down on it, it's actually not that bad for you. But if you're doing the full sugar and you're chomping on them like I know most of my grandparents do, then that's a problem.
Okay, and are flossers just as good as dental floss, like those picks, Dr. Lane?
Well, yes, they can be really effective. Flossers don't go quite as deep, and they don't curve around the sides of our teeth quite as well as traditional floss does, but it's really effective in getting the bulk of that plaque that sits in between where your toothbrush doesn't reach. So they can be a really great adjunct as well.
Gotcha. Well, thank you both for your time and your expertise. We so appreciate it. If you missed any of this, maybe you're talking with your spouse or your kids about something, this is the resource to go to. It's in the Who Wants to Know section.